100 milligram IM, so approximately 1 milliliter to my patients. And I'll be using the dextrose in a vial for. Before I prepare the medication, I'm gonna check the medication against the MAR twice, so the patient's the actual medication against the MAR and also against the doctor's order. And the third time will be with the patient at the patient's bedside. I'm gonna check for any history of the medication or the other medication or any side effects or adverse effect that might be contraindicated with the medication. I'm also gonna go over to the patient's room, introduce myself, check for the patient's name and date of birth, and also any allergies that they might know of. Gonna let them know the medication, which is dextran in 1 milliliter form, which I'll be administering to them in the deltoid. I will let them know about the side effects such as drowsiness, headache, nausea and diarrhea, and also constipation. Now to give a medication on a flat surface, and because I will be administering 1 milliliter, and it is in a vial form, with my needle. Just having a hard time with me. There we go. I will pull out 1 milliliter of air. So now I will give it the Comazine and the deltoid. I'm gonna inject that 1 milliliter of air into the vial. Before I do that, I'm gonna wipe the vial with an alcohol swab. Check the air. Now I'm gonna withdraw 1 milliliter of the medication. I'm gonna make sure there isn't any bubbles. Just to make sure. Perfectly fine. I'm gonna go over to my patient now. And if I were to, I've washed my gloves, so I applied gloves. Before I did that, I'm gonna change the gloves and put on the new glove. I will pull this. And this is given in a Z-Tract form, and the reason of that is because it is known to stain the skin. So the Z-Tract method reduces the skin staining. I'm gonna clean my sites. When administering a Z-Tract method, you are pulling the skin away from each other, so I can pull it out a little bit away, 90-degree angle. I'll administer medication and let the skin to fall back. Just wipe it down a little bit without putting pressure. And remember, with a deltoid, you do not aspirate, so no aspiration. But in other route, I will aspirate. And I'm gonna dispose my needle in the disposable sharp container. I'm gonna wash my hand, take my gloves out, wash my hands, make sure I monitor the patient for any side effects or for any reactions to the medication. And I'll be back in about 15 to 30 minutes to make sure that they haven't experienced any negative effects as well. I'm gonna go to the MAR, document my medication using the patient's history. So I gave the medication to the right patient, I gave the right medication, the right route, the right dosage, and also at the right time. So I'm gonna conclude it with the right documentation and every side effect and every reaction the patient might have complained about. And I'm going to sign.